Hello everyone. In the previous video, we have introduced why we need to inquiry and what's the significance of inquiry. Also, we have introduced some cautionary tips that we need to think about before the inquiry. Okay, so from this video, we are going to study the contents of inquiry. During an inquiry, what need to be asked? The content of inquiry, sometimes it change a little bit. Also depends on what's the purpose of this information. The information or the contents of inquiry we are introducing now are actually for the purpose of writing a full medical case, a full medical file. So you need to have all of these information. The first is general information, that's including the name, the gender, the age, marital status, nationalities, occupation, place of birth, employment, contact details, current vehicle address. That's because we need to have this information, especially for gender, age, different age for children, for infants, or for senior patient. Different age may have different disease, or they are more likely to suffer from different disease. You can see from the age. Because for some disease, they are more likely to happen in certain group of people, certain age of the people. And also the patient have married or not, nationality, where they live, what do they do? For instance, if someone coming from the other African countries, especially for the Western African countries, then the patient presents with fever. So we need to think about the malaria. But if the patient is from, such as even from South Africa, or from other countries, such as some Asian countries, Europe, so the chance of getting malaria is less. So we need to know what's the nationalities, or what's the occupation, and where they live. These information sometimes can help us for the diagnostics. Employment, what do they do? Are they employed or unemployed? Because these also sometimes will affect their emotion. So from all these, we can have a general ideas of the patient's health. Even for occupation, if someone they work in the mining, so this patient they might suffer from lung problem is more because of the dust. So that's some disease occupation related. So from here, from all these general information, we will have a general idea of the specific patient. And then the second is the chief complaint. The chief complaint, also sometimes called as the main complaint. The chief complaint is the symptoms or illness that's the main concerns of the patient. So from this words, it means this is the reason why the patient comes to you. It should include the main symptoms and their duration. So from the chief complaint, you need to know why the patient comes to you. And these actually the patient will tell you. If a diabetes patient, the patient with hypertension, diabetes for a few years, but now, so he sometimes got headache, and sometimes he got numbness feeling in the feet. This patient, and now he got flu, or he got runny nose. So he came to you, and for the chief complaint, you need to write the runny nose for how many days. You should not write hypertension or diabetes for how many days, because that's not chief complaint. That's not the reason why the patient come to you now. So the chief complaint can explain the reason why the patient come to you now. When we use the words to describe the chief complaint, when you write down as some sentence of the chief complaints, there are some rules of the writing. So here, in the meantime, when we introduce the contents of the inquiry, we also give you a brief introduction of how to write the medical case. So that's the last session of our diagnostics. But sometimes when they relate it, we will include here, such as the chief complaint. The writing, no more than 20 words, which means don't write a sentence that's for 30, 40, or 50 words, especially for the medical students or the lecturers. We can write a sentence with 50 words with a lot of clause. So for the main complaint, for the chief complaint, do not write a sentence more than 20 words, which means you need to try to limit the words, try to limit the symptoms, the chief symptoms. You need to identify it. You need to identify which one is the chief symptom, which one is the most concern the patient comes to you. If you understand well of the patient's chief complaint, you should be able to write a sentence less than 20 words. Now, the second is no disease name or diagnostic results from the chief complaint. So from this sentence, don't use any medical terms. Don't use any medical terms only if the patient has no subjective symptoms or abnormal signs, but has the abnormal findings by health examinations or the test. So which means the only time you can use medical terms or the blood test in the chief complaint is only when the patient don't feel anything discomfort, only when the patient discover these kinds of problem from a health examination, such as if the patient went to have a blood test every year, and all of a sudden he realized that the cholesterol is slightly high. But for this cholesterol, the patient doesn't have any complaint. So when he presents for this blood test to you, and he will say that doctor, I need to fix my cholesterol. What can you do? Now for this complaint, then we can write cholesterol there. But if a patient presents with other symptoms, if the patient have headache or dizziness, and then from the blood test, you see the patient have a very high cholesterol, rather use headache, dizziness for how many days? Do not use high cholesterol in the chief complaint. Okay, so here, next we're going to give you some examples of what this means. Examples: coughing, runny nose for 1 week, aggravates for 2 days. chest pain for 5 days, aggravated for 1 day. And then, so here are 5 sentences. Let's see the sentence first, and then let's discuss what's the difference. Chest pain for 5 days. The next one, diabetes for 1 year, aggravated for 1 day. High blood sugar for 2 months. So when you see these 5 sentences, why I put 2 tips on the first 2 and the stop sign of the last 3. That's because the last 3 sentences is not a good sentence while writing a chief complaint. From the chief complaint, you can see from the first sentence, coughing, runny nose, 1 week, aggravated for 2 days. So from this sentence, you will know what happened to the patient. Cough, runny nose for 1 week. So that's the term. What happens and how long? It had been 1 week. But the patient has coughing and runny nose for 1 week. Why he come to you now? That's because this sentence aggravated for 2 days. So that's a chief complaint. The chief complaint from the sentence, although I didn't see the patient, but from this sentence, I will understand that what happened to the patient. For 1 week ago, the patient had cough, a runny nose, and 2 days ago, the symptoms aggravated. That's why he came to me now, right? The second sentence, chest pain for 5 days, aggravated for 1 day. So this patient suffered from chest pain for 5 days and now become worse for 1 day. So that's exactly why the patient come to me now. Why he didn't come to me yesterday? Because yesterday didn't feel that bad. So that's why we said these 2 are good examples as the chief complaint. Then we will see the other 3. Chest pain for 5 days. From this discussion, we will know that the patient has chest pain for 5 days. So from the medical case, you will write there, and then your clinician, your supervisor, will have a review on these cases. But from these cases, from this chief complaint, chest pain for 5 days. So for me, when I see this sentence, what happened to the patient? Why for 5 days? He only come to you now. Why he didn't come to you from 4 days ago or 3 days ago? What happens in these from 5 days ago, from the 4th day until today? What happens to this whole process? So from 5 days ago and now, the patient has the chest pain for 5 days. What happened to here? These 5 days is when was this? So for this, it's not a good example as the chief complaint, because from this sentence, you won't be able to know what happened to the patient, why he come to you now. The second is diabetes for 1 year, aggravated for 1 day. So from this sentence, we understand that the patient come to you because something wrong or something become worse from yesterday. That's why. For 1 day, that's why they come to you. But for diabetes, the patient suffer from diabetes was diagnosed as diabetes for 1 year. But for diabetes, you know what's wrong with the patient? Not really. The reason why is diabetes has many different manifestations, such as thirsty, or losing weight, or they eat a lot and urine a lot. Or sometimes for the complications, the patient may suffer from heart problem. The patient may have nerve damage, such as numbness in the feet. So from the diabetes for 1 year, it's not specifically talking about what's wrong with the patient. We don't know from this sentence why the patient come to you. Is it from the blood sugar or from the complications? So from this sentence, we won't be able to know what's wrong with the patient. The high blood sugar for 2 months. This is very similar to the first one. The patient have high blood sugar. So this patient might have no symptoms. He might accidentally check the blood sugar and realize that he got the high blood sugar for 2 months. Why he came to you now? Is there any other symptoms? So try to avoid these kinds of description. Try to avoid writing these kinds of sentence in a chief complaint. These two, the first two, coffee, runny nose, 1 week, aggravated for 2 days. From here, you will understand clearly what happened to the patient, what happened to these a few days, why the patient come to you. And we need to write in very brief way. So that's why within 20 words, try to reduce the words as much as you can. So that's the chief complaint. The second is the history of present illness. The present illness, by the way, for the chief complaints, the symptoms should less than 2 symptoms, such as you can reverse a little bit of the video, or you can compare with your notes, because I can't reverse while recording. The symptoms, such as the first patient with cough with runny nose. These 2 symptoms don't write a lot: cough, runny nose, difficulty breathing, or headache for 1 day. Try to reduce to 2 chief symptoms. The complicated or accompanying symptoms less than 3. So you can write if the patient have headache, fever, runny nose, and cough. 4 symptoms. For these 4 symptoms, you need to understand which one is the chief symptom. For instance, the patient may have a fever for 1 day, accompanied by runny nose, cough. That's acceptable, because from this description, you will understand clearly what happened to the patient. So you can't use fever, cough, runny nose, and headache for 1 day. You don't know which one, if the main complaints, which one is the main symptoms, the most discomfort for the patient. Okay, so that's the chief complaints. The second, for the history of present illness. The history of present illness, we need to ask the onset, when was it happened? How did it happen? Is there any cause, especially any very obvious cause, such as someone got heart attack, someone got the chest pain? And you can ask, do you have any causes such as anger or fighting with others, or you see some very sad news? So these are some of the causes. Or even sometimes the patient someone have the acute backache. So they have the backache and it's quite painful. If you ask what happened to you before the pain, sometimes the patient will tell you that I was moving the sofa and all of a sudden I feel the sharp pain. So these are the onsets and the symptoms And how does it happen? The next, we're going to ask the patient the development of disease. From the onset, from the when the patient suffers from something until now, in this process, does the symptoms become worse, become better? So we're going to ask them according to the time towards now, such as from 1 week and 2 days ago, something changes. So we don't ask them for 1 month ago and then jump for what happened to yesterday and then what happened to last week. If you want to ask this, you can ask for what happened to 1 month ago, and then 1 week ago, and then what happened to yesterday. So we're going to use this kinds of time order. Don't jump, because these will confuse the patient. Also, the development of the disease, you can ask when did the patient feel better or worse? Is there any changes to the disease? And also sometimes when the patient comes to you, if they have been to other practitioners, you can ask, have they been diagnosed as what kinds of disease or what kinds of treatments they have received? And then what's the results of the treatments? In this situation, you can have a second opinion from the other practitioners, and also you can avoid the treatments that is not effective, such as if the patient have certain pattern and then you think that treatment A should be useful for the patient, but then the patient tell you that they have been to the other practitioner, they have been applied these treatments on them, but the results is not that significant. Therefore, in this situation, you can avoid the treatment which is not effective. Also, we need to ask the current symptoms. The current symptoms is one of the most important present illness. We're going to ask one of the most important symptoms or manifestations that we are going to distinguish. We're going to identify what kinds of patterns. So for the current symptoms, we're going to introduce specifically from the next video. We're going to use quite a few videos to talk about the current symptoms. So these are the history of the present illness. Sometimes the patient may have 2 or 3 present illnesses. If these present illnesses are not related, we're going to use different separate paragraphs to describe each of them. So we don't put, for instance, if the patient comes to you for runny nose and for cough, and then you write a short paragraph of the history, how this happens, and what kind of treatments he has accepted, and what's the result, and now how did he feel. So you write a few paragraphs of these symptoms. But this patient also have diabetes for a few years. He has been using some medicine, and he also monitored the blood sugar. So if you want to write the information in your medical case files, so this is the first why the patient comes to you, the chief complaint, and then the history of present illness. So you describe a few words here, but the patient that's 1. The patient have another disease, that's 2, of diabetes. So from here, if you want to write the history of diabetes, in this case, you don't write from here. Okay? You write a separate paragraph, and then you will describe here that what happened to the patient, what's the treatment, and now. So you use different paragraphs to describe the present illness if these two illnesses are not related. The reason why we need to discuss here is because if the illness is not healed, it is considered as present illness. And then from the next slides, you will see that's the past or previous disease. Here is the onset. So you can go through these slides. The onsets can help us to identify the cause, location, and nature. Acute condition with short duration are diagnosed as excess. Chronic recurrence are often diagnosed as deficiency. These are not 100%, but just give you a clue. What's the excess? Do you still remember what's the excess and deficiency? In the theories, in the pathogenesis, we said the excess is the pathogen, the violent pathogen. The deficiency is the organ's deficiency. Your excess refers to a pathogenic qi. Deficiency refers to antipathogenic qi deficiency. Right. So when we study the diagnostics, we need to include the knowledge previously in the previous study. The more you can remember, the better you will be eventually. And we actually, obviously, we do understand that from the study, from all these a few weeks, you won't be able to remember all of these. That's why during our study, we will repeat again and again. That's how to help you to understand and remember. Development of disease. You need to record the development and all changes. Diagnosis and treatments. What kinds of treatments they have received? What kinds of diagnosis from the blood test, the examination, or other practitioners? Current symptoms. So from the present disease, we also need to ask the past medical history. The past medical history refers to the disease that the patient suffered before, but this disease must already healed. If the disease is still not healed, it is considered as the present illness, the history of present illness. So we need to ask the previous health, physical activities, or the habits, such as the body constitutions, what kinds of food the patient prefer to eat, or what kinds of diet they prefer. Even when they drink waters, what kinds of cold water or warm water they prefer to drink. That's just in general the previous health, and also the previous disease include previous injury, diseases, surgical operation, allergic conditions, especially for the medicine allergies. So for these, need to be asked in the past medical history. And also for some children, we also need to ask the vaccination history, because this can help us to exclude some diseases. The personal life and lifestyle. life experience. Where do they live? Where they have been to, or especially such as the pandemic like now, the COVID-19. Where have they been to? Have they traveled to the affected countries? These are very important for your diagnosis. And mental and emotional status. This is related to the environmental and social changes. So these you also can ask about if you think that they are related. Lifestyles. Lifestyles will affect our health. That's from you see all these informations we already mentioned in the prevention in the basic theories, how to prevent diseases, how to strengthen the antipathogenic qi. It's all from the lifestyle, your diet. So you need to ask about the lifestyles of the patient. You maybe have a general idea of the patient's antipathogenic qi, or have the general idea of their body constitution from their lifestyles in terms of the diet and exercise. For instance, if someone they like to eat KFC all the time, and then they're more likely to have excess heat in the body. If someone they don't exercise, they're more likely to have spleen deficiency. That's because you don't move, and then you cause the weak body constitution, which reflects in acquired qi. This from the spleen deficiency. And from spleen deficiency, the patient may suffer from dampness. That's why you see some obesity patient or overweight patient, they're more likely to have dampness in the body. That's because of the spleen deficiency can result in dampness or phlegm. So these are something from the diet and lifestyle. The marital status. Marital status, especially for patients in the mature age or sexual mature age, we need to ask about the marital status because this we can help us to identify some diseases, especially for some diseases have family history or some disease with like sexual transmission diseases. Also for ladies, we need to ask about the menstruation, how many days the menstruation, how many days the cycle, and what's the volume of the blood, and any diarrhea or any discharge. Also, we need to ask when was the first menstruation. If some lady in the menopause age, we also need to ask when was the last menstruation, and also any symptoms during the menopause. For some married patients, we also need to ask their how many kids they have, how many kids they have delivered, and is it a normal delivery or others. So these you can have for these questions, you can have a general ideas of the patient, especially for the patient's health in general, like life experience, lifestyles, mental or emotional status. Okay, so these are some of the information we need to ask. And the last one is the family history. Family history consists of information about disorders from which the direct blood relatives of the patient have suffered. The direct blood relatives refers to parents, offspring, siblings. And sometimes we also need to ask what's the cause of the death of their direct blood relatives. Because some diseases, they have the family history, and then the patient will have a higher risk of certain diseases, such as hypertension, diabetes, cancers, and mental health problems. These sometimes have the family histories, so that's very important to ask them, especially for the question there, for the cause of the death of their direct blood relatives, especially the age when they pass away, or especially when they pass away in very early age or very young age. You need to ask about the cause. Sometimes the cause can help you to identify the disease and also can help you to generate a treatment plan for the patient in their lifestyle, how to prevent, how to reduce the risk of the disease in their family history. So these are most of the contents in the inquiry. That's also the information we need to record in our medical case, in our medical files. We need to record all these informations. So in this video, we give you a brief introduction on the contents of the inquiry. What do we need to ask? And these contents are actually the information we need to write in our records. And from next video, we are going to talk about the present symptoms. So the inquiries on the present symptoms is especially for different symptoms that we can use to distinguish, to identify different patterns. Okay, thank you guys.